And now this special report from a COVID ICU in Mumbai with beds almost full. Doctors say they're trying to keep up pace by increasing the numbers of facilities. KEM Hospital, the BMC's largest hospital, treats only critical patients.
As the second wave of COVID hits Mumbai, hospitals are once again filling up. But this time, doctors say they have a plan and they are better prepared to tackle the crisis and the challenge that is before them. Now, obviously, there are a huge number of admissions. Admissions are increasing every day exponentially, and that's something that is a challenge. I have with me Dr. Santosh Salagre, the professor of medicine, who's also in charge of basically creating these COVID facilities at KEM Hospital, which is one of Mumbai's biggest hospitals, and here only critical COVID patients are treated. So, Dr. Salagre, obviously, from what we saw in last year to this year, obviously you have a plan, you're better prepared, you know a little bit about the virus, you know you have a definite treatment protocol. But what is more different this time? What are the most challenging situation you're facing now in a ward like this?
The first and foremost is the speed at which the second wave has taken a sharp increase. That is drastically there. So, the second part of it is the kind of symptoms which patients are coming up. We had a typical respiratory symptoms in the form of fever, cold cough, loss of smell, loss of taste in the first wave. But now what we are finding is lot of patients are coming with gastroenteritis, malaise, body ache, non-specific symptoms, and also the patients which are coming in a stable condition. Distinctly we have noticed in this second wave that after 5 to 7 days, suddenly patient becomes bad, and that time patient becomes so bad that he requires intensive care management with ventilatory support. So these are the gross differences which we have noticed. And as you rightly said that yes, we are better prepared this time, and that is how, though the number increased so fast, but being already with the experience of pandemic, we could really face little better than last time.
So now, you said treating patients this time is a bigger challenge, you're saying, given the fact that the state in which they're coming in is difficult. Why is that happening?
The difficulty lies in the number of patients coming at a given time. What happens is, our being a tertiary care center and a leader of MCGM run facilities in city of Mumbai, what is important is we are dealing with critically ill patients, those requiring high flow oxygen, those requiring all the kinds of invasive and non-invasive ventilation. So when the number of patients, what used to happen? Last year, at any given time, this 35-bedded ICU which was created on 8th of August used to have say 10 to 15 patients requiring ventilator or ventilatory related support. Now what we find is the number is like yesterday's occupancy of this ward is 33, and out of that 28 patients are critically ill.